So we start with our general palpation, right? Light and deep, we did liver. The next we're going to palpate is gallbladder. Okay? So I want to come mid-clavicular line, right side. You see where I've got my hands, fingers kind of under the costal margins. Does that make sense? Up towards the liver. Now I'm going to ask the patient to take a deep breath in. Comes down, let it all out. As he lets it all out, you see how I follow him in? And then I hold that position. Now I'm going to ask him, go ahead and breathe in again. Good. Now that brings the liver and gallbladder down towards my hand. Is that comfortable? It's not comfortable, right? It's not. However, if someone has cholecystitis, that hurts. Has anyone in here had cholecystitis? One of your classmates earlier this week had it. Was talking about in the hospital. They performed that test, and she said she wanted to kick the doctor. Right? So I mean that you're going to feel that if it's irritated, pressing down into towards the fingers, that pressure is going to make it hurt. Does that make sense? That is called Murphy's sign. Okay. So we had Murphy's kidney punch, Murphy's sign. So Murphy was busy, right? Murphy's sign is for the gallbladder. So, has anyone in here had appendicitis? You've had appendicitis? Do you have a scar?
I think so. They taped me. They didn't sew me. So.
Oh, I had it.
Okay.
I had like 3 small ones.
So you had laparoscopic, right?
Yeah.
So see where he's looking for the scar there? So that is called McBurney's point. So we're going to talk appendix now. First thing I want you to do when we do appendix is find McBurney's point. So you're going to find the anterior superior iliac spine and the umbilicus. You see these 2 points? We draw a line between them. And then you're going to come up 2 inches from the ASIS along that line. That is McBurney's point right there. That's where your appendix is roughly located. That's where his scar is because that's where they went in to operate on the appendix. Does that make sense? So what's this point called? McBurney's point. So you're going to find that first. Then we're going to perform Rovsing sign. Okay? R-O-V-S-I-N-G. Now, there's a test called Rebound Tenderness. I told you there were peritoneal signs in lecture, right? What were some of those peritoneal signs? Signs of peritonitis. Rigidity. What's that?
That's the one I remembered.
Loss of bowel sounds. So we looked for rigidity with our light palpation. We listened. Loss of bowel sounds, we have to listen for how long before we say that? 2 minutes. Good. What else? Fever is one of them. Pain with percussion. Was percussion, should it be painful on you? No. The other was a positive rebound, right? So rebound tenderness is a test we can perform for peritonitis. It means I push in and I release, and the pain is greatest on the release. Not when I press in, on the release. Does that make sense? So you can perform that in different places. Now, if I perform rebound tenderness in the left lower quadrant, here, and the rebound elicits pain at McBurney's point, that is a positive test for appendicitis. And that's called Rovsing sign. So rebound tenderness in the left lower quadrant that elicits pain at McBurney's point is a positive Rovsing sign. Okay? All right, then we're going to perform psoas sign. There's a couple different ways. I just have the patient kind of raise your leg a little bit, hold it up, don't let me push down. There. If that causes pain at McBurney's point, it's also a positive test for appendicitis. Now, your appendix, which way does it face? Does everyone's face this way? This way? Some face this way? It can be all different directions. For those that face posteriorly, this test is particularly sensitive. Why? Because it's facing right towards that muscle. Does that make sense? Okay? So, Rovsing sign, what's this called? Psoas sign. Psoas is a flexor, right? Good. The last one we're going to perform is called heel jar. Get up on your toes like this, as high as you can get, and drop hard. Don't stop it. Drop hard on your heels. Can you feel how that jars your body? Right? You see if you have parietal irritation, how that would hurt? So heel jar is actually the most specific, up high, boom, for appendicitis. Now, in the hospital, they'll perform a modification because the patient's often lying like this, and they'll come here and just go and jar. Does that make sense? So technically, this is heel jar. That's the modification. You can perform it on your final either way because it's on the final practical. So if you want to do that or have them stand up, heel jar will be all right, okay? So we performed, what was the test for gallbladder? What do we call it? Murphy's sign. Then we found McBurney's point, and what were our 3 appendicitis tests? Rovsing's, which is a rebound tenderness in the left lower quadrant that elicits McBurney's point pain. Rovsing's, what else? Psoas and Hiljar. Okay, go ahead and perform those on your patient.